Actually, the two breeders were come, so I am a bit late. Okay, let's start. My case is a 30-year-old male with history of IBD, ulcerative colitis, pancolitis, without any extra intestinal manifestation. For initial 4 years, he was in clinical remission, but for last 1 year, he has repeated episodes of relapses for which he sought multiple consultations with different gastroenterologists. He was started on multiple uh, sessions of steroids, but he was poorly responsive to steroid. And about 3 months ago, he was started with adalimumab, which also failed to improve his symptoms. When patient came to me, he had a stool frequency of 4 to 5 per day. He had occasional blood in his stool, no abdominal pain, there was no any fever. On his general examination, it was found patient has mild pallor. There was no icterus, no any edema, no lymphadenopathy. His weight was 54 kg and blood pressure was 128 by 84 millimeter of mercury. His pulse rate was 78 per minute. On his abdominal examination, there were no organomegaly. There was only mild tenderness in left lower quadrant. Other systemic examinations were unremarkable. His lab parameters were hemoglobin was a bit low. It was 10 gram per deciliter. RBC were microcytic and hypochromic. Differential counts were in the range. His platelet count was a bit on higher sided, and the CRP was also on higher side. And his renal function, thyroid function, normal. LFT shows only slight decrease in his serum albumin. Other transaminase and alkaline phosphatase were in the normal range. He was non-diabetic and viral markers were negative. Stool examination shows no ova, no parasites. Clostridium difficile toxin were evaluated and it was shown to be absent. His fecal calprotectin was significantly high, and on CT enterocolonography, no extraluminal pathology were there. Small bowel was completely normal, but in his large bowel, he has diffuse non-enhancing thickening in the rectosigmoid region. Colonoscopy was suggestive of normal ileum, cecum, and ascending colon, and below that, he has a moderate severe ulcerative colitis. Chest X-ray was normal, and Mantoux test was negative. At present, at that time, he was on Pentasa sachet, 2 gram twice a day, Budage OD tablet, and 9 gram per day, tablet folic acid and tablet Selcal. The case was discussed with patient and his relatives, and they were agreed to start with the tofacitinib, and it was started in a dose of 10 milligram twice a day. And within a span of next 2 weeks, his stool frequency decreased to 3 to 4. No blood were evident after 3 weeks of treatment, and after 4 weeks, stool frequency came to 2 to 3 per day without any adverse effect. And after 8 weeks, stool frequency was 2 per day, and there was generalized well-being feeling of the patient. After 8 weeks, his stool frequency was 2 per day, no blood. Hemoglobin was improved, 13 gram per deciliter. WBC in the range. CRP came down to normal. Fecal calprotectin came down to normal. Albumin improved. That means patient is improving with the tofacitinib, and he was advised to continue the same medicine, but in a decreased dose. And the in maintenance therapy, he was put on a dose of 5 milligram twice a day, and he was asked to visit after 2 months with complete blood count and CRP and LFT levels. And at present, patient is doing fine, and when he will come, next course will be discussed with the patient and his relatives.